Joining me now, Chief Medical Advisor to President Biden, Dr. Anthony Fauci. Dr. Fauci, good to see you. So more than 150,000 cases per day, more than 1,200 deaths per day, ICUs filling up, and almost all of this is preventable. A new model from the University of Washington projects more than 100,000 additional American deaths to COVID by December 1st. Is that really possible?
Jake, unfortunately, it certainly is. You know, what is going on now is both entirely predictable, but entirely preventable. And, you know we have the wherewithal with vaccines to turn this around. And the reason you see the numbers that are so alarming that you just gave is that we have about 80 million people in this country who are eligible to be vaccinated, who are not yet vaccinated. We could turn this around and we could do it efficiently and quickly if we just get those people vaccinated. That's why it's so important now in this crisis that we're in, that people put aside any ideologic, political, or other differences and just get vaccinated. We'll make the vaccinations as easy and convenient for people. We want them to come forward for themselves, for their own health, for those of their family, as well as for the community. I know you don't want to be pushing people in the sense of making them feel guilty or getting angry with them, but to essentially plead with them to look at what's going on now. This is very, very important, not only for your own health, but for the health of the country. And we can do it. We have a great vaccines, more than one, 3, and they're safe and they're highly effective.
I know that you're hearing from doctors who think that the Biden administration, which has been very aggressive on this issue, but some people think that the Biden administration should be even more aggressive, mandating vaccines for all federal employees, mandating vaccines for anyone who gets on an airplane or a train. What do you say to them?
Well, Jake, I am very much in favor of mandating at the local level. I don't think we're going to see federal mandates except for certain agencies of the federal government. I mean, we've already seen that with the Veterans Administration, but now that we have the full approval, the full stamp of approval, at least for the Pfizer vaccine, we are definitely going to see mandating for colleges, if you want to attend in person at a college or a university, or places of business that employs large numbers of people. I think you're going to see that, and I actually encourage it because I think that's one of the ways that we can get many, many more people vaccinated.
President Biden on Friday said that he's been talking with you about giving Americans booster shots, not just 8 months after their second dose, but 5 months after their second dose. Why are you considering ramping this up? Is that on the table? 5 months?
Well, first of all, we're still aiming at 8 months beginning on the week of September the 20th. But as we said in the original declaration, we have to go through the process of the FDA, as well as the Advisory Committee on Immunization Practices, which advises the CDC. And although we are sticking with the 8-month timetable beginning on the week of September the 20th, we remain flexible regarding the time frame, depending on the data as it continues to come in.
Is there a potential risk of allowing boosters after 5 or 6 months, those who want them?
Well, you know, the issue is that's a very good point, Jake. That's what the FDA and then ultimately the ACIP is going to look at, the risk-benefit ratio. There is no doubt in my mind that we need to give individuals who receive the 2 doses of mRNA a 3rd boost. There's no doubt based on the data we've seen. We're now working out how to do that in an expeditious way, rolling it out so that it's done in a way that we get as many people vaccinated who need the boost. And right now, as I mentioned, that's aiming at around 8 months. That will start on the week of September the 20th. But there's flexibility in that, and that's what we're going to be keeping looking at.
I want to ask you about some local issues. Culver City Unified School District in California became the first public school district in the U.S. to require vaccinations, not only for teachers and staff, but also for eligible students who are 12 and over. Now that the vaccine has full approval from the FDA, the Pfizer vaccine, would you like to see it mandated for students elsewhere in the U.S.? And once it's approved for kids under 12, should it be mandated for them too?
You know, I know that a lot of people will be pushing back against that, but if you get the imprimatur about the safety and the strong benefit risk ratio for the children, when that gets established, which I believe it certainly will, by the FDA and the ACIP, I believe that mandating vaccines for children to appear in school is a good idea. And remember, Jake, this is not something new. We have mandates in many places in schools, particularly public schools, that if in fact you want a child to come in, we've done this for decades and decades, requiring polio, measles, mumps, rubella, hepatitis. So this would not be something new, requiring vaccinations for children to come to school.
The governor of Oregon is now imposing a new outdoor mask mandate for both unvaccinated and vaccinated individuals when physical distancing is not possible. Is there a scientific reason that justifies an outdoor mask mandate for vaccinated Americans?
Well, you know, Jake, before I comment on that, I'd have to know what really the detailed circumstances are that the governor was talking about, or whoever it was that made that statement. Because, you know, there are certain circumstances when you have very crowded congregate settings, even on an outdoor basis. And remember, the CDC has said that there are circumstances, somewhat unusual, but are circumstances, even in an outdoor situation, when you have clustering of people together, that it might be better to be wearing masks.
6 weeks ago, Florida Governor Ron DeSantis' reelection campaign committee started selling shirts and more that say, "Don't Fauci my Florida," and attacking what he called Faucism. Now, just in the 6 weeks since the governor's reelection campaign launched those products, more than 5,000 Floridians have died of coronavirus. What do you make of the way some of these governors and politicians are attacking you?
Well, I mean, whoever is attacking me, just a reflection of the politicization of what should be a purely public health issue. And it's really unfortunate. You know, they're attacking personally me because I'm a visible person, but I'm merely articulating the proper public health practices that are recommended strongly by an organization, and that organization is the CDC. So they like to pick out a certain person because they could make that person, you know, the personification of political divides, which is so unfortunate, Jake. We should put all of that aside. We have an extraordinary problem that's killing people in the United States, killing us, putting us in the hospital. So that kind of politicization that you just mentioned, there's no place for that when you're dealing with a public health crisis.
Poison control centers are reporting that their calls are spiking in places like Mississippi and Oklahoma because some Americans are trying to use an anti-parasite horse drug called ivermectin to treat coronavirus, to prevent contracting coronavirus. What would you tell someone who is considering taking that drug?
Don't do it. There's no evidence whatsoever that that works, and it could potentially have toxicity, as you just mentioned, with people who have gone to poison control centers because they've taken the drug at a ridiculous dose and wind up getting sick. There's no clinical evidence that indicates that this works.
For a long time now, I've been reading about prominent mask opponents and vaccine skeptics, talk radio hosts and other personalities getting COVID and dying. There have been a number of those reports in the last week. What goes through your mind when you see stories like those?
Well, Jake, it's tragic because you don't want to see anybody, regardless of what their position is or their ideology, you don't want to see anyone get sick or die, particularly as a physician and a scientist. I do everything in my entire career to safeguard the health of people and to save lives. So even if they have views that I completely disagree with, it's really tragedy to see them get sick and dying, fundamentally because they're putting aside and avoiding the public health principles that we talk about all the time.
Hurricane Ida is bearing down right now on the Louisiana coast. It's a powerful storm, Category 4. Louisiana officials are expressing their concerns that crowded hospitals might become, and shelters might become places where people get COVID. How concerned are you about how the hurricane could theoretically make things worse in states that are already struggling to keep up with the pandemic?
Oh, Jake, it bothers me considerably. you know, you're having two potential or real catastrophes conflating on each other. It's bad enough, the situation in Louisiana, even though, quite frankly, you know, the governor of Louisiana is doing a very good job, you know, in trying to keep things under control, John Bel Edwards. But we're having a situation where even when you're stressed to the limit, to superimpose upon it what will likely be a historic weather environmental catastrophe is going to do nothing but make things much, much worse.